Your loved one has high blood pressure. High blood pressure is often known as the silent killer. So here's what you need to know. I want to make heart health easy for all of you to understand. So I've created a heart health guide. It's free and there will be a link below for you to have access to it. So let's dive in. Hypertension is when your arteries that are in your body are exposed to long-lasting periods of high pressure. So it's often called hypertension or high blood pressure. It's really important because it is the leading cause of heart attack and stroke in the United States. 1 in 3 Americans have high blood pressure, but unfortunately, only 50% of Americans have their blood pressure well controlled. So there's a lot of reasons why someone may have high blood pressure. I'm going to give you an example of a couple of the ones that you can actually manage. They include obesity, not exercising, being exposed to secondhand smoke, diabetes, and high cholesterol. There's also some risk factors for hypertension that you can't control, like men have a higher risk of having hypertension. Age, so as we get older, we have an increased risk for developing hypertension. And so those are just a few examples, but the complete list will be in my heart health guide. So take a look there. Let's talk about how you can control your blood pressure. You know, I always like to tell my patients that they should be using lifestyle to try to help manage their hypertension right from the beginning. Things such as exercising regularly, at least 150 minutes per week, eating a healthy diet, not smoking, losing weight. Those are some of the easiest ways that you can take control and hopefully not need blood pressure medications by just simply changing your life. Not everyone can control their blood pressure just with lifestyle changes alone, no matter how hard they try. And that's okay. Sometimes you need medications to help lower your blood pressure. And these medications are often safe with used under the direction of your doctor. Each medication will have potential side effects, but it's important that you talk to your doctor about what those potential side effects are and trying to find the right medication for you, because controlling the blood pressure is the most important factor. So you're making all these lifestyle changes and you may or may not be taking medications, but that's because we want to get you to a blood pressure goal. It's really important that you're checking your blood pressure at least once a day and after medications if you are taking them. It's very important that you're sitting with your feet flat on the ground and have been resting for 5 minutes before you check your blood pressure. Make sure you're not talking or active listening while you're checking your blood pressure. Also have your arm at the level of your heart, and that will give you an accurate blood pressure. Now, the goal is we want everyone's blood pressure at rest to be less than 130/80. You may think that blood pressure is not important because you don't feel it or you might not have symptoms of high blood pressure. However, managing your blood pressure is one of the easiest and the best things you can do to prevent yourself from having a stroke, getting dementia, and having a heart attack. So I encourage you to not ignore your blood pressure and be aware, know what your numbers are and know what you can do to make your blood pressure better. If you want more information about heart health, make sure to subscribe to my channel and we'll see you soon.